So we're halfway through 2020. What has COVID-19 taught us? We know to wear masks, avoid crowded spaces, and social distance, wash our hands, and we've also learned that Black Americans have disproportionately died from the disease. And then George Floyd died.
South Minneapolis still smolders tonight over the police custody death of George Floyd.
And before George, it was Breonna Taylor.
The protest originally over the police shooting of Breonna Taylor last March.
And before Breonna, it was Ahmaud Arbery.
Headlines this morning, the shooting death of a young Black man who was killed after being chased by a white father and son.
People took to the streets to protest despite COVID-19. But as a white woman,
I'm not the person to speculate about what this moment means, especially not for a show called Positive Spin.
however, if nothing else, is this the moment where we finally admit that systemic racism, much like COVID-19, is also a public health crisis?
It doesn't matter what I do in this country, what any of us Black people do in this country, it is a death sentence for us.
For months, Americans have been preoccupied with our health, talking about signs and symptoms and preventative measures. But what if we thought about racism, much like the way that we think about a disease like COVID-19? It's no mystery why Black Americans have been dying of COVID at a rate just over twice that of white Americans. Many Black people have frontline jobs with a higher exposure risk, and they rely on public transportation. Black people have less access to private health insurance and are more likely to live in areas without easily accessible and affordable healthy food options.
When we add the impact of this current pandemic on these already existing disparities, it's disgusting that we're now having a conversation about racism being a public health crisis, because racism has always been a public health crisis.
That's Dr. Shanita Seeley-Jefferson. She's an epidemiologist.
When you look at the health of Black people compared to all other groups, we have higher rates of everything. We die more from everything. Cardiovascular disease, stroke, cancers, we see this across the board, no matter what health outcome you look at.
We recognize the impacts of behaviors like smoking, drinking, even loneliness on our health. So why not recognize the impacts of racism too?
We have a lot of data on individuals' experiences with racism and individuals' experiences with discrimination. We have linked that to poor health and mortality.
I also talked to Jamil Smith, a senior reporter at Rolling Stone magazine, who argues that racism, our untreated pre-existing condition, is killing both Black people and the nation itself.
And you referred to racism as the American plague. What did you mean by that?
Racism is in all of our institutions. We think about housing, we think about education, we think about nutrition, how we feed ourselves, how we've organized this entire society. What we've got to do is just kind of cut the cancer out.
Throughout our history, racism was literally written into American law, and not just in the Jim Crow South. For example, redlining policies in places like New York, Chicago, and Baltimore allowed banks to deny mortgages on the basis of race. This trapped many Black people in high poverty neighborhoods, hurting the ability to build generational wealth.
A lot of us are living in communities that have fewer resources. Our schools are underinvested. The jails are overpopulated by Black and brown communities. That relegates people who are impacted to lives that are limited. The impact of structural racism on Black communities is not something that we can opt out of.
Because racism is not just a systemic infection, it's a bodily one too.
Life course stressors, lifetime stressors, stresses from oppression overwhelm our natural ability to cope. That results in the breakdown of our immune system. That makes us more susceptible to chronic and infectious diseases. That makes us more likely to die early.
Some studies have shown that having a positive racial self-image, basically Black pride, may help mitigate some physical impacts of racism, particularly in some Black men. And yet white pride, and in some iterations, white supremacy, has long been what's on display in the United States.
Well, it looks like, white folks opposing Martin Luther King holidays. It looks like white folks insisting that Confederate statues stay up.
What's Black Pride then?
Black Pride is replacing those names with the Crispus Attucks, replacing those names with Frederick Douglass. You don't have to put even war heroes' names on them. Put statues up of Sally Hemings on Monticello. Let's do that instead of glorifying people who held people in bondage for generations.
Technically, this is a series about finding the positive in bad news. But rather than offering a flimsy summation about what this historic moment means in the fight against racism, we went to a demonstration and spoke directly with protesters to find out what it's like to go through this health crisis while being Black.
Do you think that racism is also a public health crisis?
It definitely is. It definitely is.
It's bigger than that, I feel like, you know? Police brutality is a pandemic in itself.
It's one thing to dispose of the head. It's another thing to dismantle the system that the head was operating.
Until we take the racist laws out of the system that are stopping us from reforming our education, reforming our healthcare, reforming every other aspect of life, this country is always going to be in that position.
He has to be a part of this. He's 3. I can't explain it to him right now in a way that he would understand, but when he gets older and he asks us what we did, we'll be able to talk to him about this. Like, you were there too. Yeah. You went out there too.
When everybody's not able to operate at their full potential, when we have a hierarchy of human value, where some people's lives are valued less than other people's lives, that does something to all of our humanity.
Do you think that this is a point, like a breaking point?
This surge of accountability, I think to some degree that's encouraging, because I think it shows a sort of rudimentary effort to educate themselves. Because I think people haven't had an opportunity to get an anti-racist education. They didn't get it in school. I know I didn't get it in school, and I'm Black. I remember my 7th grade history book, I'll never forget this, had 1 page on the Civil Rights Movement. I knew that our people were so much greater than that. So what I need for people to do is to not be satisfied with the minor steps that they've made in these first few weeks.
The next step would be action. So we have to figure out, and when I say we, I mean white people have to figure out all of the ways that racism is showing up in our society, that privileges them unfairly, and divest this unearned privilege.
So we're halfway through 2020, and what have we learned? And more importantly, what do we do now?
We have had a 400-year history of oppression, and that is a long time. And that should be unbearable to people whose history is different from that, because we are all here together. We should all be part of the solution.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.